Right, I think we've probably got a few more people to join us, but I'll start. So yeah, this is the agenda. We're really delighted to welcome Dr. Chair Kuma today, who's the clinical co-director of one of our primary care networks. But just hear about the COVID-19 primary care response. So thanks very much for joining us, Pravin. And then we've also got Sam Walters, who does a sterling job as one of our team managers in environmental health, and who's kind of worked solidly for a year on the COVID response and is going to talk to us about reopening. And then we've got Jenny Rogers from Cultural. I don't think her name's Jenny Rogers Cultural, although that would be a brilliant name for a cultural development manager. I think her name is Jenny Rogers, and it's great to have her with us because she's going to talk about the most recent exhibition that Culture are putting on around COVID. So that'll be great. And then we'll have some time at the end for questions. And as per normal, we've got a really good team on, including sort of Dash from the CPG, Emma from my team to answer any of your questions. So I'm going to start with the intelligence update, which is our standard format. So if I could have the next slide, please, Sarah. So we've slightly updated the format. You can see it's what we've done is we've introduced all the different stages, so it gives you a sense of how numbers have responded to events. And towards the right of the screen, you'll see we've got the stage 1 of roadmap. So that schools opening is the first line, and then social contact outside, and then the final line is when the hospitality and lots of things opened, didn't they, on the 12th of April. And you'll see that actually our numbers are going down. I will talk about that a little bit more later in the slide set. So you'll be very relieved to see, and you probably already know because of the Monday briefing, that we are no longer the second highest rate in the country, which is a huge relief to me. I went on annual leave for a week with strict instructions to the team to get that rate down, and they did a great job, and it's reduced. So we're currently, our rate as of sort of Monday was 48.2 per 100,000, which is a big jump down from the week before. What I would say is we're looking at the data every day, and actually that is starting to go back up. Which is not unexpected, because we knew that with the opening up of the district, I mean, you yourselves will have seen there's been lots of people out and about, you know, it was inevitable that those numbers were going to plateau or perhaps go up a bit. So I think it will probably see a slightly higher number next week, which, and just the thing is, it's about, you know, seeing that in the context of what's happening, also bearing in mind that the working age vaccination is happening, but you know, where our biggest rates are, the vaccination won't have happened there yet. I had my vaccination this morning. I'm nearly 46, so that gives you a sense of where we are sort of with vaccinations, and I think can't remember, I think it's 43-year-olds are allowed to book now. So went very smoothly, and very proud to have my vaccine. But obviously, you know, that we're not seeing the benefits of that quite in the working age population like we have in the older population. And you'll see that we're also middle of the pack in West Yorkshire, because again, I was not exactly delighted to be the highest rates in West Yorkshire. And I believe Kirklees now has the dubious pleasure or privilege of being, I think, one of the highest rates in the country now. So that's really challenging for Kirklees colleagues, and we really hope to see that go down. So again, we just show you this just to give you a bit of a sense of how many lateral flow tests we're doing. We've had a query on lateral flow tests, so we'll give you some more details on that later about where to access them. And that's fairly sort of plateaued at the moment. We'll see how that goes. And those are tests for asymptomatic people. So this is always a really interesting slide for me, because it's about age-specific rates, and you'll be aware that COVID impacts on different ages of the population differently. So just hearing again from the Chief Medical Officer yesterday at one of our briefings that, you know, the evidence remains the same on young children, so under 5s, that really they don't seem to contract COVID, they don't seem to spread COVID, and that's really sort of demonstrated in our figures. You can see that 0 to 4 age group, very, very low rates, and that's been fairly consistent throughout. And then if you look at those top 2 lines, that's our 11 to 16, sorry, and our 17 to 18s. So with COVID, once someone hits puberty, you tend to see a similar clinical picture to adults. And obviously that's a population that have been heavily tested with lateral flow tests over the last few months. And unsurprisingly, we've picked up a number of cases. Just a slight note of caution that sometimes that does result in double counting, so we need to be a bit cautious about those figures, and as you can see, they have dropped right down. And then our 80, in fact I'll do that on the next slide, Sarah, if I could just have the next slide, it's a bit easier to see on that one. So this is sort of our gives you a good sense of where our biggest rates are, and you can see that second to top row is our 80 pluses, and very low numbers now, 12 per 100,000. So that is fantastic, and that is absolutely testament to the vaccine campaign, which is brilliant. I think I've told you before, but especially as we've got Dr. Jai Kuma on today, just to say that Wakefield is I think the only area in West Yorkshire where all of the primary care networks are continuing to deliver vaccinations. So brilliant really that Wakefield districts have done so well there, and that, you know, it's really exciting for a public health geek such as myself to witness a huge vaccination rollout. I've never seen that before with well, I suppose we have with HPV vaccine, but this feels a bit different, and then to see those numbers respond to the vaccination campaign is really exciting. So again, just sort of an encouragement to anyone on this call to just keep encouraging people in your community to get those vaccinations. So then if you look at your middle age groups, you can see that we've still got those relatively higher rates within that working age population. Again, we'd hope to start to see that 25 to 59 age group come down over the next few weeks and months in response to the vaccination campaign. So again, the reason why there's so much white on this map now is because when we get to numbers below 4, we suppress those numbers in order to maintain confidentiality for those individuals. So the map is looking exactly as we would want it to look. There is no sort of obvious areas that are looking very high, and lots of white on the map now. So that's really good. So just to say as well that we do get quite a lot of inquiries from elected members and members of the public worried about rates within their ward area and those fluctuating. And just to bear in mind, because those are quite small numbers, you will see fluctuations from week to week. The thing to do is look at the trend. So look at the week before, the month before, and what you'll often find is that you'll have been one of the lowest in the district, you'll be one of the highest in the district, you'll go back to being one of the lowest. So again, just to sort of bear that in mind. So again, I like this slide. I think a lot of people find it quite interesting. I think I show it to you every week. And again, you can see those bubbles have got smaller. But we are also still seeing workplaces and shopping now as one of our main kind of common exposures. Again, sort of just a note of caution, I think, around the shopping one and possibly the workplace one, which is we're not saying that this is causing your COVID infection. What we're trying to identify is places you visited before you become infected. And I don't know about you, but I have definitely gone shopping in the last 7 days because I've been able to. First in the queue outside HomeSense, and I'm sure other people will be the same. So it's not necessarily that they've contracted COVID during shopping, it just means they've been shopping in the 7 days before contracting it. So we need to be a bit careful around that data. So this is a brilliant slide. I'm so pleased to be able to show you this one, because what it shows is that our hospital admissions have dropped right down to 20. So and of those, only 9 are Wakefield residents. So I mean, how you can see from the slide how horrendous things were in November and even sort of in February, how anxious everybody was about the system becoming overwhelmed, and it's absolutely fantastic. And again, it's a really good testament to the vaccine campaign, because the people that were going into hospital and very sadly dying of COVID were the older age population, and they are now not going into hospital. So that's wonderful. So that's a great slide. And the next slide as well, I think is also a very positive one, where we've seen those COVID deaths come right down. And actually we have, I think last week there were 0 COVID deaths in the district for the first time, I think, since COVID began. So again, really heartening for us to see that. I think that's the end of my slides. Maybe do you want to do the next one, Sarah? Yeah. So I'm happy to take any questions now, or we can about the data, or I don't know, Sarah, if you want us to wait till the end if it's a really packed agenda. thinking it probably is a PATS agenda. So we'll maybe move on to the next set of slides and then either answer questions in the chat or ask them later. So I'd just like to hand over to Dr. Pravin, who is going to talk about the primary care COVID response.
Hi everyone, thank you for inviting me to talk to you today. So what I'm planning to do is just very briefly talk to you about primary care networks, what we are, just to remind you. I think you've probably heard that before, and then just to go through some of our response on how we've coordinated and delivered the vaccine programme in Wakefield from a primary care perspective. So primary care networks are groups of practices that have come together to kind of coordinate, enhance care, work jointly with community providers and other agencies to improve the offer that's available to patients. They haven't been around long. They've not even been 2 years. They'll be 2 years in July. And actually, primary care practices in England, 99% of practices in England do cover, are involved in a primary care network. And in Wakefield, every practice is part of a primary care network. We do have 7 primary care networks in Wakefield, and we'll come on to that shortly. But as you can see, there are over almost 1,300 primary care networks in the whole of England. When they were formed, the average size was said to be around 50,000, but obviously depending on practice size, that varies. So we do have some that are slightly smaller, maybe 35 to 40,000 in the country, and some that are quite big, maybe getting on to 100,000. So this is a map of Wakefield. So the area you probably recognise, kind of map, you probably recognise roughly where your practice is located. So we have at the top, we've got the Brigantes Primary Care Network, which has covered practices like Outwood, Stanley, New Southgate, Alverthorpe, Homestead. On the left, so as you look at it, the pinky area, that's West Wakefield, and that's probably one of our bigger primary care networks. That covers Ossett, Horbury, Middlestown, Lopsett, and Chapelthorpe. Right in the middle, the pink area is the Trinity Health Group, where I'm one of the clinical directors. We've got Trinity, Warrengate, Maybush, and Crofton. And then as we go on to the east, along the top, you've got the green area, which is Wakefield Alliance North. You've got the purple one, which is Wakefield Alliance Central, and then down the bottom, which is kind of your Ackworth and South Hempsall practices. You've got your Wakefield Health Alliance South. Just in the top where the green area is, there are some orange dots you can probably see, and they make up the 5 towns primary care network. So that is slightly different, and they're not quite all geographical, but they do cover very similar populations. Okay, so primary care services, what's it include? So currently, the traditional primary care model has always been GPs, practice nurses, healthcare assistants. But the networks have expanded to involve a bigger team so that patients are getting kind of more specialist advice or guidance or support or assessments first time. So we have pharmacists and pharmacy technicians who look after your medication. We've got people like first contact practitioners, which are a relatively novel concept. But basically, if you present to us with a musculoskeletal problem, your GP, who, as we all know, are generalists, will assess that and make a recommendation. But the first contact practitioners are often advanced physiotherapists, where this is their bread and butter to them, this is their day job, and actually you'll, instead of having to go through a GP to then get a specialist assessment, you can go straight and get that specialist assessment, which feedback from our patients has been really positive. Live Well link workers, they're part of our social prescribing offer. So primary care isn't just medicine these days, and we do see a lot of people who have social issues that need sorting, and we hold a lot of knowledge, but we don't know everything, unfortunately. So these Live Well workers really can help signpost people who need who may be isolated, who need support with housing, who need support with finances, and they're really, really helpful to us, and they do link in with each of the networks. We've got clinical coordinators who aren't medically trained by background, but are linking in with patients to offer them services that maybe a GP is not familiar with. So again, they link in with the social prescribing, but they're also really helpful at doing things like ensuring patients have a learning disability review and a dementia review, and they are able to often perform those because they have specialist training in those areas. From April, so this month, we are going to very soon hopefully have some mental health practitioners. We know mental health is on the rise. We know it's much more talked about, and so we have more people presenting to us. And again, a bit like the first contact practitioners, we want people to get that expert help first time without having to go through multiple channels to get to what they need. And that's a really positive step, and that's something we're looking at doing in combination with our local mental health trust. The other service that's not on there is paramedics, and we do hope to have some paramedics with us soon as well. Paramedics are really good at same-day urgent assessments from their background, and we are hoping to employ those to be able to do these assessments for people either in practice or in their own homes who do need that service. So as you can see, the team has grown over the last few years, just from your traditional primary care model to several other healthcare professionals who work with us. One of the perceptions that we had during the early stage of the pandemic was that primary care was closed, and that's never been the case. We have been open the whole time, but how we've assessed and contacted patients has transformed. So the old model of having to book an appointment, wait for that appointment, sit in the waiting room has changed. So we've now followed the national guidance and done something called total triage, where we will speak to every patient who needs to be spoken to on the phone. But we don't stop there. If people need a video consultation, we can do video consultations. What we find really helpful are photos. So people who present with rashes or some lesion that needs looking at, people send us photos and we assess them that way. However, no patient who needs a face-to-face appointment is denied one. If somebody, after they've been clinically assessed through the total triage model, is determined to need a face-to-face appointment, they will get a face-to-face appointment, and that is universal across all practices. The other thing is that mentioned down there is about PCN. So during the pandemic, we have worked even more closely together, and that's been shown with the vaccination program. But we've had times where practices have been under pressure because of staff being off with COVID, and so the PCNs and working together has meant that we've been able to kind of share services across practices to be able to ensure that the offer to patients hasn't been altered. What else are we doing in practice, as well as the usual things that we do? Acute problems, routine problems, long-term conditions. We have allocated care homes who we do a weekly ward round on for residents, and that works really well in that patients get continuity, and also care home and practices get a really good working relationship, which has been shown to improve patient care. We're seeing quite a lot of palliative and end-of-life care, and we're supported with our district nursing service and the Macmillan team with that. Still offering screening, baby checks, postnatal checks, and immunisations for those who need them. Those who are vulnerable are prioritised, so we do make a conscious effort to contact our learning disability patients and those patients with a severe mental illness. And those who are flagged as being at risk of admission or complications, they are under a GP, and we make sure that they get followed up. A&E has been under considerable pressures during the pandemic, and one thing that we've pushed to all practices is that they use the what we call the operations line. So when we assess patients, we don't necessarily send them all to A&E if they need a hospital bed. We do have access to the admissions line in which we can speak to a clinician and then determine which is the best place to be sending that patient, so that they're not sat in A&E for hours, and that works really well. And then obviously we know shielding has now ended, but shielding was with us for quite a few months. And so, for example, our clinical care coordinators were really good at making contact with those patients, ensuring what they had and they had what they needed. There was obviously the National Volunteer Service, which helped patients with, for example, delivery of medicines. And those patients, we are still flagging those patients. So if, touch wood, we don't need to, but if we ever need to go back into another lockdown, then we know which patients are at risk and we can identify them very quickly. So we are here, as you know, as I said, we're here. Our out-of-hours service is called GP Care Wakefield, and that's an extension of your practices. So one of the things in Wakefield that works really well is if you need kind of the primary care services, you just need to know 3 numbers. You need to know your practice number, 111 or 999. So ringing your practice number when we're closed is not a problem, because of your phone line should direct you to the GP extended hours service. That's GP Care Wakefield. We're working more closely with 111 now, so they're aware of what services we offer. But you do have access to things like the King Street Walk-in Centre, which are also working over remotely via a Total Triage, but they see people who need to be seen. And then the Urgent Treatment Centre at Pontefract, which has always been operational right throughout the pandemic. So just a few slides on the vaccination programme. So in Wakefield, all PCNs, all practices have signed up to do the vaccinations, and so all PCNs have signed up. So since these slides were written last week, things have changed a little bit. So we're now into cohort 10, but we're only up to the 42-year-olds in cohort 10. So all patients who are eligible will have either had an invite through the practice or through the National Booking Service. Sometimes people will have had both. So currently you have the option of booking into either the National Booking Service via 119 or going online, or you can book in through the text message you will receive from your practice. As Anna mentioned earlier, all networks have gone into phase 2 of the programme, and that's the under 50s essentially. And we are the only area locally, I think in West Yorkshire and Harrogate, where you've had 100% sign up. So we have committed to ensuring our population is vaccinated, and we continue to do so. It's really important that when people receive their invite, that they take up that offer, because obviously the sooner we can get the whole population, or as much of the population, vaccinated as possible, we can start easing all the restrictions that are in place and hopefully get back to some normality. It's really important that you get your second dose as well, because that gives you that boost on top of your first one. So what we do for that one is we aim to get you, we aim to invite you around the 11-week mark to get your second dose. You may get your invite a little bit earlier, but that's fine. But what we're trying to do is ensure that you do have your second vaccine within 12 weeks, as is directed by NHS England. And what we're doing is, for those who haven't come forward themselves and booked their own appointments, we are proactively trying to contact them. So there is as you can imagine, there are a lot of patients and a lot of staff time is taken on contacting these people. So that's why it's really important that you do take up the offer, if you can via your text message, but if not, we will aim to call you. But if you haven't heard anything for your second dose by the 11-week mark, please contact your practice, because we will sort that appointment out for you. So there has been some concerns about the Oxford Astrozeneca vaccine. One thing we do know is that the risk of blood clots is tiny, but they have made some suggestions to us. So those with certain conditions that might predispose them to having a blood clot, we have suggested that they have the Pfizer vaccine. And also the available evidence to them shows that the younger people, so those under 30, are at slightly higher risk of having blood clots than those who are older. So again, those patients are offered Pfizer, and we are accommodating that. If patients under 30 have had an AstraZeneca vaccine for their first dose a few weeks ago, and that they're often people like carers or health professionals, and they have no problems, we are able to give them a second dose of AstraZeneca. So we've got systems in place to ensure that they get that and they get the right vaccine. But if for some reason a patient has had an AstraZeneca vaccine first time and has developed one of these rare clotting problems, then we are able to give them a second Pfizer dose. So they are fully covered, just like everyone else. And this is really just a plea. Some people are concerned about the vaccine, and I understand why. So there is a little bit of vaccine hesitancy. People hear stories from, friends, relatives, neighbours, that they felt quite unwell after the vaccine, and that happens. I did, after my second vaccine, felt unwell for 24 hours. But what having COVID will be far, far worse. And so I think for a day or two of side effects, it definitely outweighs getting COVID-19. And I'm not sure if anyone's had COVID-19, but touch wood, I haven't. But it's not pleasant. So let's get everyone vaccinated and move forward with our lives. So in Wakefield, we've done really, really well. We've vaccinated 180,000 people. And I think these were last week's figures. In West Yorkshire and Harrogate, so that covers kind of Kirklees, Huddersfield, Harrogate, Leeds, Bradford. We've vaccinated the most percentage of our population, so we've done really, really well. We've we're well on course to getting a kind of almost a full coverage. We're never going to get to 100%, but we are for the first nine cohorts, we're well over 90% for all of them. So yeah, well done everyone. So who's been involved, because it's been brilliant. That's it. Thank you very much.
Thanks so much, Pravin. And just I was just listening to the news this morning. Other people may have heard it say that PHE have done a study on the vaccine showing that I think it's a 50% reduction in transmission within households where someone's been vaccinated. So I think when you're younger, you are less at risk of COVID, but obviously you come into contact with older people and some people who either may not have been able to be vaccinated because of health conditions or won't have had a good immune response. So it is really important that younger people get the vaccine too, to protect the sort of wider community and loved ones. So thanks, that was a really, really good presentation. And we'll now hand on to Sam, who's our team manager, to talk about as we come into the as we reduce our restrictions, what's going to happen. Thanks, Sam.
Let me take myself off mute first. That's a good start, isn't it? So good afternoon, everyone. So just in terms of what I've been asked to cover, I know a couple of weeks ago I did cover about the roadmap. In particular today, I'm concentrating on the NHS Test and Trace app, and this is part of the reopening, given that from a couple of weeks ago on the 12th of April, we did get hospitality, tourism and leisure industries, close contact services, community centres and village halls reopening. Now, this information that is actually on these slides is lifted directly from that link there. So if you are wanting to have a little look at a bit more detail, because it does go into more detail on that app, on that link, you can certainly visit there. So that's why I've left that there on the top. So basically, the Test and Trace has, it's been with us quite a long time through the pandemic. And it's been predominantly, this part of it has been linked to, most of you will know about having the app on your phone, or when you've been out to eat previously, you may have been asked if you don't have a phone that's compatible to write your details down. It has been revamped a little bit for the roadmap and for the reopening of businesses. And basically what I'm just going to run through as quickly as I can is the new requirements. So basically there are a set number of businesses that do now have to comply with the Test and Trace requirements. And the requirements are that In those type of venues that are listed under the regulations, they must ask every customer or visitor over the age of 16 to provide their name and contact details. We will touch a little bit more on what these mean as we go through. They must keep a record of all staff working on the premises and shift times on a given day and contact details. And they should keep these records of customers, visitors and staff for 21 days. If they are instructed and they get contacted by NHS Test and Trace, they must supply those details, and it is a requirement to do so. In each of these venues, they must display an official NHS QR code poster. Now, just touching on that there, if you've had, yeah, I was going to cover exactly what you've covered there, Arthouse. What I was going to say is if you've had the previous QR codes, they will still apply, but what the government is advising is that you go back to the link, which you can get through that contact there, and actually download a new one, because what they're doing is a little bit of work behind the scenes just to look at who, first of all, the information will have all the relevant up-to-date information. There are new posters out there, but also it's just a bit of a refresh and the links may work a little bit better. So I would advise that if you can go and just get another poster downloaded from that link, it would be better. So basically, the idea is that you have your poster, it's in a predominant place as you're entering the premises, and that visitors can literally easily use the phone and access that business by checking in using their phone. If that's not available, then they do need to provide an alternative. The rules must always adhere to the general data protection regulations. What we did have previously was people going out to a restaurant and having to sign a book as you walked in, and everybody could see all those details, your telephone numbers, your names, your addresses and everything. That is not permitted. You must have control on that data, just like any other data. If you're going to use a logbook or something like that, it must be brought out, the information gathered and taken away so others can't see it. Hospitality venues have additional requirements under this requirement and must also take reasonable steps to refuse entry. That is in law. So if someone says, I'm not signing, I'm not providing my details and I'm not using the app, then that business should refuse them and not serve them and allow them to come in. Again, there is this what's reasonable will depend on the type of venue and context. We have had some challenges that have come through to us in the Covid-19 enforcement and environmental health, where people have been challenged on this. So again, we've just got to try and look at the context. Venues should satisfy themselves they've done all that could be reasonable possible to be expected to refuse entry, and failure to comply would result in fixed penalty fines, most likely. So again, a lot of this is very repetitive, but basically just thinking about any establishment. So if you run an establishment and you think, does this apply to me or not? It is, all the establishments are provided in detail in that link that was there previously. But really think about it in the terms of, if it provides an on-site service and there's any events taking place, or you're going to be a captive audience that at some point you're going to sit there for a period of time. So basically, if you're going to go in, you're going to go buy a coffee in Costa Coffee, other coffee shops are available. But if you went into Costa Coffee and you ordered a drink and left and took it off site, there's no requirement to check in there. If, however, you're going to go into Costa Coffee and basically you are a paying customer, you would go in, sit outside, you should check in because you are a captive audience at that premises. And it's the same for barbers, hairdressers. If you're going into a leisure centre and you're going to undertake an activity there, or a gym, etc., something like that. It could be asked for at the counter rather than point of entry, and it could be asked by the servers. I think one of the points that a lot of businesses, they will book in advance, so people will book tables, book meals, and you can take that information there. And it does say if you've got multiple points of entry, you'll need to ensure you have a system that meets legal requirements. So you can't have just it on one entrance. If you've got other entrances, you must make sure that they're covered. In terms of the question there about the QR code, they should be using, it is the one prescribed one, so it isn't the bar one. They have to follow the test and trace one, so we do need to have a look at that. So if you've got some information, do feed that through to us. So again, we've covered venues must ask every customer and visitor over the age of 16 for the following details unless they've checked in during using the code. So they must have all of these details. So that's the name of the customer or visitor, contact telephone number for each customer or visitor. Now, this is a change from previously. Previously, you could go in as a party of 6 and just one person give their details. Now it is everyone who is over the age of 16 has to provide contact details. The only exemptions there in the law is if a person is disabled or incapacitated, so that they could provide that information if they were the carer, etc. So that would be, there are some reasonable exemptions in law, but there should be appropriate. If you are able to do so, you should provide a contact and a name. And if there's not a telephone number, you should ask for email addresses instead. And if they fail to either aren't produced, then it's a postal address. The information should record the date of visit, the arrival time, and where possible departure time. But it's not requirement for departure time, so quite often we'll just get the date and the arrival time. The name of the assigned staff member, if a customer or visitor will interact with, if it's only one member of staff, that should be recorded as well. For example, the hairdresser, and recorded alongside that, those details. So in terms of staff as well, so all designated venues, if you're required under these conditions to have the app and to have it in place, you must also keep a record of all staff working on the premises on a given day, time of the shift, and contact details. And this covers anyone providing a service or activity, including volunteers. And venues must keep these records of staff, but obviously staff can choose to use the QR code poster in addition if they wish. So there, the link is in there for how you can get one of the new QR posters. And the other requirement, which again is a legal requirement, is that to support, you must hold the records for 21 days, after which then they should be destroyed. That is to cover the incubation period, and it allows an additional 7 days for that information to filter through to test and trace, and for us to be able to go and look and see what the situation is. After 21 days, it must be securely disposed of, very much like any other data would need to be. So what information should be shared with NHS Test and Trace? So basically what will happen is the Test and Trace, are ourselves in the local authority teams will only ask for these records where it's necessary. Now, there is some set criteria, and there's 2 trigger points. One is where 2 or more people later test positive for COVID-19 who visited your premises on the same day. We'll go into that in a bit. But if you're asked to provide those records, you must share them straight away, and it is a legal requirement, and you mustn't delay on that. There are penalties for doing so. There's penalties if you say I don't have that information. So it is really important that you do have that information. If you don't share those promptly, then it would be reported to our team to investigate further. So basically, that once the details have been provided, Test and Trace will take all of that information and they'll use it to let people know if they may have been exposed to COVID-19. Now, depending on the numbers of people who test positive, they may be advised to go and book a test, and we will go into that. It's very important that businesses don't go and inform customers or visits. This is not for you to start telling people as a business, oh, we think you may have been exposed. This is for Test and Trace to have a look at all the information, to have a look at times and all the other bits and pieces to say, has there been an incident or hasn't there? And you would be given clear instructions if you are contacted by NHS Test and Trace as to what to do. Again, this is really important because this is not what happened last time. Lots of businesses just closed the establishment, put it on social media, and obviously in one instance we had Sky News who came up and parked in the car park and they just didn't expect that at all. So it is really important that you kind of liaise with Test and Trace and your local public health teams just on a bit of guidance and what to do next. So basically, they will take the information, like I say, look at everything. They will consider whether you've taken all of the steps to reduce COVID-19. They'll notify individuals of possible exposure, and that will either be via a text message or a notification in the app. It will not be an instruction to self-isolate, but you will be notified of potential exposure and reminding you to wash your hands, maintain social distancing. Venue wouldn't be named, but if more than 4 people, so that's 2 people, so that's a warn and inform. That's what it's called. It will probably cover that in a sec. But if it's more than 4 people who've tested positive, then they would be encouraging you to go and take a test. So that could be the same venue, the same day. You can see how this can get a little bit complex, because you can have venues that are open 24 hours or 12 hours. And some people test positive that went in at 9, and some people who tested positive who went in at 3. Nowhere connected whatsoever, but just in terms of that they've entered that venue on that day. If a staff member, customer or visitor does tell you directly that they've tested positive, you should tell them to stay at home and self-isolate, and encourage that individual to contact Test and Trace. It is against the law to use information you've collected to contact people, so you don't go around contacting people yourself. It's literally through the Test and Trace. So this is that warn and inform, which we've covered. So basically, this is the information that you will get on your alert. You've recently visited a venue on the same day as others who've since tested positive. There's a risk you may have been exposed. Around 1 in 3 people do not have symptoms. You do not need to self-isolate. And this is the information that would be sent through to you as an individual if you're on the warn and inform. So that's 2 or more less than 4, but 2 or more. So that's the information that you'll get through as a warn and inform. And then if it's 4 or more people on the same day, you will get this message. So basically, you've recently visited a venue on the same day as others. There's a risk you may have been exposed. And for this reason, please book a test now. So again, you don't need to self-isolate, but basically it's advised that you go and book a test. You don't need to do so if you've tested positive in the last 90 days. And that's the general information that you would receive as the person who's provided those contact details. Right, okay, so just touching on that, the information then, so that will all be in Test and Trace, but what will happen for us who are sat in the teams is that if there is any absence of data, if there are any concerns that are flagged by Test and Trace on the numbers that are associated with the venue, we would look into it in more depth to see, has there been a point incident? So we would probably request the data and say, well, these 4 people, were the one party? Were they in at the same time? Which member of staff did they liaise with? And we would look more into, is there a point source? Has this potentially happened and there's been spread possibly? So we would look at a business's COVID-19 risk assessment. We would look at tables, plans, what they've got in place, etc. And we would take, inference from that and see if there was anything more that we needed to do. The information will be shared. It will come into the local authorities and we will get a lot more information. This is being delayed a little bit, but I believe it started this week. So it's a bit of a watch and see as to how the Test and Trace will liaise with us in local authority and what that will mean. Apparently they will report if they're aware of businesses that are open and there's not QR codes, and people are advising, I wasn't asked to scan in, or I wasn't asked to complete a logbook, etc. So again, we're just waiting to see how that is. We are getting some anecdotal information and some information, some complaints from members of our public who are saying no one challenged me, and I was there and I wasn't asked for it. So we are following up on those businesses. I don't know what you want to do with, because there are some questions that I can see in the side. Do you want, should we leave those until a bit later, or do you want me to cover them now?
I think because we're short of time, Sam, if we could just let Jenny present, and then we will provide written response if we don't have time to do verbal responses.
I was going to offer, actually, I can be rolled over if there are lots of questions. It's your choice. I know you've got a lot of people and they're busy people, So the offer is there if you want me to come back next
Thanks,
time.
Jenny. That sounds a bit painful being rolled over. I think we'd really
know.
like to hear from you, Jenny. We
Okay,
always
cool.
get more questions than we can answer, and we do send out written briefings. So
Well,
yeah,
I learned a lot,
I'm really ready to get what you've got to say. So I would love to hear from you.
Okay, magic. Thank you so much then. Thanks so much for having me then. And thanks, Sam, for all of that info. I learned a lot about track and trace just by arriving early. So hopefully everyone can see on the screen some images under a title, Together and Apart. We just wanted to briefly pop into the meeting because your colleagues across the district that have been just, I guess, at the forefront of responding to the pandemic, helping our communities through and being really instrumental in how Wakefield as a district has responded. We want to let you know about an upcoming exhibition. So it's entitled Together and Apart. It's going to take place on the 10th till the 20th of June in the former Market Hall. And it's a collection of really varied artwork. So we've got poetry, we've got landscapes, lots of really high quality photography, we've got film, we've got craft pieces, we've got a large scale immersive installation that you'd wander around when you hopefully come along and visit. All of the pieces are created by artists from the district, and often they're working directly with communities. So you've got some pictures on the screen, that's a still from the film made by Kappa College students. And you've got an image on the right of a pupil from Castleford who was still going into school at that very beginning of the pandemic when there was only half a dozen children from a key stage rattling around school. The purpose of the artworks and commissions was to document and chronicle this extraordinary time. So the work started back in April of 2020. A lot of it carried on till the autumn, and we're working really hard at the moment to bring it all together, to provide an opportunity for residents and visitors to reflect on the year, to remember collectively the extraordinary experience, and looking at themes around hope, resilience, and absolutely loss, because we recognise that is an experience that many people have lived through, but also looking at ideas around remembrance and definitely community coming through really strongly as a theme we're showcasing in the exhibition about how we've all adapted and changed and what that's meant for us as a whole moving forward. So we wanted to let you know it's coming. We'll be properly launching all of the kind of promotion just after the election. So look out for stuff on the 10th of May when we'll be into the sort of countdown. The good news, because I know you're obviously colleagues that are very conscious about COVID safety, is the space is very large. So there's loads of room to socially distance, but we are really looking for help and encouragement to make sure that people come along and visit and make that time to kind of reflect together about the year and do that through some really wonderful artwork to experience. We've got a couple of events that I wanted to flag that are, I suppose, sort of particularly programmed events that might be of interest to colleagues on the call. If they are, please hang on or pop in the chat and I can maybe pick that up with you after. One is on the 13th of June in the morning. We'll be having a relaxed sort of visit session, so it might be of interest to anyone that works or supports families or individuals that are on the autism spectrum. So we'll be trying to make it a really welcoming space. We always will anyway, but we'll be doing some making relevant adjustments. And then on the 12th of June as well, we're also going to have an audio described event. So if anyone here particularly works with residents with visual impairments, it would be great to connect with you there. I can answer any questions, but watch this space. We'll be launching it soon, and I would really like any help and encouragement to make sure we get some people along to visit. Thank you.
Thanks, Jenny. So Sam, there's a few questions for you in the chat. Although actually, sorry, let's go on to the next slide, because I think we've had a couple sent in previously that we should probably do first. Oh yeah, I won't dwell on this slide. Just we'll send it out, but about how vaccinations work. But I think given the time we've got left, we've done quite a lot of work around the immunisation. Yeah, so I think the one about vaccination cards, I'm not quite sure. Having had mine this morning, I did get a card, which I think I'm supposed to bring back to the next session. I don't know if Dr. Jayakum or anyone can answer that. Our GPs for the second vaccination, it hasn't been provided a card, and the reception staff say they don't give them out. Does he need a card? Are GPs still giving them out? Do you need to take your first card back?
I don't know whether Pravin can.
Yeah, I can answer that. So when you get your vaccine, your first vaccine, you should, if NHS England have sent us enough cards, get a card that we detail your first vaccine on, and then when you come for your second one, we ask you bring your second one, and we'll just update it with the second vaccine. However, they are not, that's the ones, Anna. They're not 100% proof, because they can easily be forged, because they are just a piece of writing on a piece of card. Your GP practice does have kind of information about your vaccine, and that is in your clinical record. Obviously, going forward, there is the talk of the vaccine passport and how you'll need that to be able to go on holiday. And I know today they were talking about potentially integrating that into the NHS app, but those are initial thoughts. So if you've got your card, fine. If not, it's not the end of the world, because it will be on your GP record. So I hope that answers that.
Yeah, thank you. So, and then just the second question about a senior support group. There's a whole load of venues where you can access lateral flow tests from, and it's a very long list, and we'll be sending that. We can send that list out to everybody, can't we, Sarah? Just so you've all got access to that information. So rather than go through it now on the call, we'll do that. I've just seen one in the chat that's making my blood boil already, about an instance when an employer is reluctant to allow a member of staff time off to get a second vaccine jab. They'll be getting a call from their Director of Public Health, Coach Paul, just saying. So, but I don't know. Sam, you might know this. Anyway, I don't know it, but under the Health Safety at Work Act, does the employee have any leverage to be able to get time off for their second jab?
It's a difficult one, because I think it's up to the, you've got to be reasonable, but I don't think there's anything stipulated in law that you could argue for or against. I guess it's what's in conditions for that particular workplace. It seems really unfair, because ultimately it's protecting everybody in that workplace. So a difficult one, that one, but I'd probably advise him to go via his HR and get a second, if there is HR.
Yeah, without being too devil's advocate, having said I will ring them and have a go at them, but also I think there are, having just put my jab myself, I may have mentioned that today already on the call, and there are actually quite a lot of appointments available at, weekends and things. So I guess you could, depending on the nature of the job, that's a tricky one. But I think, again, if we're getting a lot of incidences where that's happening, then I'm sure we could write a letter out to employers or something like that, and just to try and support the process. And then Sam, there's loads and loads of questions for you. We've only got a few minutes left, but I don't know if you want to just have a go.
Yeah. Okay, I'll try and whiz through them quickly. So if people don't have the app and don't wish to download it, then they must provide the details in the manual logbook. So that has to be another option that's available. Lots of people have or don't have mobile phones, so there has to be records taken. And that's for hospitality businesses more so than the others. So you can only refuse entry if it's a hospitality business. So just to make that clear, if people's details are held by the organisation, that's fine. They can book in advance. However, it is a legal requirement that they must still display and have a QR code, because you may have people coming in for maintenance and other reasons, people coming in just to book a session. So you must still have that QR code. That is a legal requirement to display that if it applies to your business. Beyond the roadmap, no idea. We know it's there, it's in place. I think the intention is that a test and trace will continue for the foreseeable future. Whether there will still be these conditions, not sure. So I can't tell you at this time. I just know it's in for now, and it will be for the May day as well. Where it goes beyond June, not sure. Wedding party planned for June. I think it would be okay to send in advance, but I think on the day you would still need to provide an updated list, because people do pull out, could be ill, and so I do think it's important, and you must have all that information that I did refer to earlier on. Is that it? Have I whizzed through it?
Thanks, Sam. That was very impressive. Honestly, I'm majorly impressed. But also, there's a really good question from Emma, which we might end on actually today, and we'll send written responses to any question we haven't covered. And that's, I think, again, sorry for you, Dr. Jai Kumar, but it's to say that So we've actually got over 130 COVID champions, and they don't all attend obviously every call, but it's been, I hope you've enjoyed today and seen how that they do play a real part in promoting messages within the community. So for example, some of our champions have got 1,000 people on their Facebook page and they post those messages out, or some people have even got community notice boards. So it's a really kind of dynamic sort of way to get messages out. And I just wondered if any initial thoughts about how perhaps primary care networks could work with the champion programme in the future. I think they're quite a key way to reduce inequality. Just to put you on the spot there.
Yeah, so I think the deprived and vulnerable population is definitely something that we are looking to focus on, because we know that they often have the greatest health needs. And I think with our expanding team, that is certainly something we are looking at. We know, for example, people have been reluctant to come forward during the pandemic. We've had reluctance from people to have LD health checks and to come in for their mental health reviews, and often these patients can get forgotten. And so what we're all trying to do is make proactive attempts to ensure that they don't get left behind, and that they do get kind of the support and the help that they need. So that's kind of an ongoing program that we're doing. And just to mention, the other thing that we've done as networks with the vaccination program is that we have gone into some of the hard to reach areas. For example, we know with some of the BAME population, there was some reluctance there to get the COVID vaccine. So what we did, instead of waiting for them to come to us, is we went to them, and we've now run 2 sessions at one of the local mosques, and that's been attended by a few hundred people. So that has been really successful. And we're also doing programs with the Homeless Project. I think yesterday we were there vaccinating some homeless people. So those populations are on our radar, and we are trying to do everything we can to include them and ensure that they don't get left behind.
Thanks so much. We are going to have to draw it to a close there. And anything we've not covered, we'll pick up next Wednesday. As always, thank you so much both to our speakers and to all of our attendees today. As always, we'll be in touch. So thanks very much. Bye, everybody.